Okay, everybody, we're going to go ahead and get started with our last panel of the day.
Thank you, Peyton. Thank you, everyone, for being here. This is our last panel of the day. And so we're going to talk about our Carolina Cohort of Cities project, and we'll go into a little bit more detail about that in a moment. We'll have our project director for that, Dr. Jake Kramer, give a little bit more information. But one, just, thank you all for being here. And I want to thank our panelists for being here. They were all won champions for this project, the Cohort of Cities, and as well as champions in the space of implementing alternative response models in their cities. So we're excited they're here. We're excited they're going to share what their programs are all about, the process of setting them up, and then kind of what next steps look like for that. So I want to start with some introductions for our panelists. I'll start with Letitia McNeil. Letitia serves as the division manager for the Office of Community Safety with the city of Greensboro, which currently houses the city's behavioral health response team, which you'll hear probably referred to as BHEART throughout the presentation. She has served for over 15 years in the criminal justice system, and her expertise includes justice program development and management, police community engagement, and public safety initiatives program development. And you'll hear more about what she's done with BHEART. Following that, we have Lieutenant Renee Lockhart. She joined the Raleigh Police Department in 2002. She's worked in a variety of areas to include patrol, domestic violence, training, and youth services. She's certified as a North Carolina Justice Education and Training Standards Commission criminal justice instructor. That was a mouthful, just as much as it sounded. For more than 14 years. And she's taught in areas to include domestic violence, responding to victims in the public, implicit bias, and de-escalation. She currently serves as the lieutenant for their Addressing Crisis Through Outreach, Referrals, Network, and Services program, which we refer to as ACORNS, which we love that name. And then we're followed by Ryan Smith, who currently serves as the director of the City of Durham's Community Safety Department, which operates their newest first responder branch called HEART, which stands for Holistic Empathetic Assistance Response Teams. And this team is a new first response that has new first response capabilities for the city, focused on calls for service, including mental health, and other calls involving houselessness, substance use, and other quality of life concerns. And Ryan will speak a little bit more about that in a moment. He joined Durham in 2017, where he first served as the innovation team director, and much of his work in that space was involving criminal justice reform. And then we have virtually joining us Dr. Jacob Kramer. He's a senior policing researcher with RTI International for our Center for Public Safety and Resilience. He's been here for a little over 2 years, and his work focuses on policing analytics, use of force, and extremism. As I mentioned, he was the project director for the Cohort of Cities project, so he'll give a little bit more background there. And then prior to joining RTI, he helped create and lead the analysis division for the Tucson Police Department. So thank you, everyone, for joining us. We're excited you're here. And I'll start with Dr. Kramer. He's going to give us just some background on the Cohort of Cities project.
Thanks, Elise. Can you hear me okay?
Perfect. Yes, we can.
Okay. Thanks, everybody. Happy to be here. I'm sorry I'm unable to join in person, but I was happy for the opportunity to join virtually. I'm out here in Tucson, Arizona. So as Elise mentioned, I was the project director for the Cohort of Cities project. So I just wanted to provide a little bit of context for this project, then I'll turn it over to the panelists to talk in more detail about the programs in their respective cities. So the project started back in 2021, and really the goal was to examine alternative responses to policing. So what are different programs or approaches that police departments and other city departments and community stakeholders might take to think differently about how police engage with the community or respond to particular issues or crises within the community. So some of the focus that really initiated this work was around mental health calls, mental health crises, better responding to individuals in need, but also to opportunities to identify efficiencies within the police departments to better dedicate police resources. So this really began with Durham, can be traced back to the year before. The City Council of Durham was interested in better understanding 911 calls for service, community initiated calls for service, and police initiated events within the community and what police were doing within the community. And RTI had been working with Durham for some time on different projects. And so Durham, came to RTI, and RTI became a research partner in this work. But Durham also was recognized that there's multiple other cities, peer cities within North and South Carolina that were facing similar challenges. So right at the outset, with the help from Durham's leadership, we involved Burlington, Cary, Durham, Greensboro, Raleigh, and Winston-Salem, all in North Carolina, as well as Rock Hill in South Carolina. So these 7 cities created this cohort, and together there was opportunities to learn and to implement these projects. So RTI joined as a research partner, and really part of the goal there was, one, to help analyze the data and understand the scope of the problems or the scope of the issues, but also to help design and evaluate these programs in a way that would build the evidence base around this work. So a lot of these alternative response strategies, relatively new ideas, and there's not a strong evidence base across the country or even internationally for some of these programs. What's working, what doesn't. So part of RTI's role in this then was to create these evaluations such that we could find what's working well, what's not working well, how do we involve the relevant stakeholders. So to do that, one of the first steps was to understand and analyze the 911 calls for service and the officer initiated events. So it was about approximately 3 years worth of data. We looked at about 4 million 911 calls and officer initiated events to understand what's going on in these communities, where are police really spending their time. So I don't want to speak too much longer. We identified a number of programs, and the panelists here will talk about some of those, but things related to mental health identification and documentation, so that a call may come into the emergency communication center, but then getting that to the right team, whether it's police or somebody else, can be a challenge because of how these data are unstandardized. Opportunities for efficiencies related to alarm verification. Police departments spend a lot of time responding to false alarms. So how can we better understand those issues? Response models, point of dispatch diversion. So there's a number of programs that were considered and evaluated, but I'll turn it over to the panelists to talk in more detail about their respective cities. Thank you.
Thank you, Jake, and thank you for that background. I'm going to pass it to Letitia to give us just some background on their Cohort program, just how you all got started, some partners and stakeholders that you all engaged, maybe some challenges or opportunities that you all experienced as you set up your program, and then just some key takeaways and what next steps would look like.
Okay, so thank you. Again, my name is Letitia McNeil, and it's the end of the day. So I am going to be brief and talk about my program. So we came into this cohort of cities at a really unique time, because in 2020, the city of Greensboro had already started looking at how we could set up some sort of alternative response for calls for service with our mental health calls. And we had contracted with an outside mental health agency, and we were having some challenges with that. There was frustration from our officers. There was frustration from that contracted service provider. And so we were looking at ways to, how do we do this differently? And so we started doing research, really looking at alternative responses to calls for service to really address our mental health and substance use disorder calls that we were receiving. And so to get the opportunity from Durham to be able to participate in this cohort of cities was really good for us, because what it did was it allowed an opportunity to kind of validate what we were already seeing. So as we went through the process of looking at how we change our model to make it more effective for the city of Greensboro, we decided on a co-responder unit. We talked to several different agencies across the country, even, locally, Cary, North Carolina, we talked with them as well. And so we decided to go with co-response. But what we wanted to do was something a little bit different. What we saw is that the other co-responder units had both their clinicians and their officers housed in the same department. And so we wanted to try and see if we could make adjustments to have our clinicians, like the clinical piece of our team, respond to a different department or report to a different department. And we did that because there was community concern regarding the clinicians and the police. There was issues of trust, and there was and it was across the board. There were people who had issue with the fact that clinicians worked in the police department or worked for the police department. Then there were people who said it's not the police officer's job to be clinicians. And so we tried to find a way to create this alternative. So this was perfect timing for us. And so what we did is we hired 8 clinicians or 7 clinicians and a treatment outreach worker. And so what they do is they respond along with our police department. We have a specialized unit of officers and they are our team. They respond together to calls for service. And once they do that, they also do some follow-up with some service coordination for folks. What I'm finding is our clinicians are also working with individuals, not only the individuals, but their families as well, and providing access to treatment and just opportunities to expose individuals to service options that maybe they may not have been aware of had it not been for that interaction that they had with the police and our BHART team. And then we also have an outreach worker who does follow-up case management services as well. And that can range from a variety of things. It could be assisting families with getting access to treatment. It could be assisting families with food insecurity issues, housing insecurity. So a lot of those different quality of life issues, we will follow up with that family or that individual and provide those services. So the challenges that I would say that we faced really were community buy-in at first, because people didn't really understand why we were doing this. Why were we having clinicians and police officers respond in tandem to something? That we were getting pushback, one or the other, in the response. And what we found is that if someone calls 911 for service, they want law enforcement. So give them the law enforcement option, but then also law enforcement needs to be supported in that as well, to have that clinician who's able to have that level of expertise and provide that service and just step in and be able to assist. So what happens when our clinicians, when our teams go and respond to a call, the law enforcement will engage initially. If someone has called 911, so the law enforcement officer engages. They make sure that the scene is secure, and then they step back and they allow the clinician to handle the rest. They don't re-engage unless the clinician asks them to re-engage. They are there merely in a supportive role from then going forward. And so what that does is that helps the clinician and the person who is maybe in a moment of crisis to be able to have that therapeutic conversation without the law enforcement, without having it be led by law enforcement. And so once that's done, they follow up. Law enforcement will sometimes go to those follow-ups with our clinicians, and sometimes, depending on the relationship that they may have with that individual, the clinician themselves may follow up with our outreach coordinator. So that's our process. And I think in terms of takeaways, I'm seeing this be very effective. We were speaking earlier about how when you do something really well, people will call on you to keep You know, they want you to fix everything. They want you to come out for anything they can think of. They know that the Be Heart team, you know, if I have someone in mental health crisis or just a mental health issue, period, we're gonna call the Be Heart team because I know that they're gonna follow through. I know that they're going to get this person engaged in services, or if they can't get them engaged in that moment, they're going to work with that person and support that person until they are able to do a warm handoff to another clinical arm to assist them. So I think that's it. Okay.
Thank you so much for that overview, Letitia. And I will pass it to Lieutenant Lockhart to give background on the Acorns program in Raleigh.
Thank you. So ACORNS again means addressing crises through outreach, referrals, networking, and service. And I want to focus a little bit on that C right quick, the crises part. It's not just mental health focus related. Actually, we look at homelessness and any substance use issues. And it's really the crisis of life. And that crisis is about that individual. So whatever that individual determines is a crisis for them is how the Acorns team is going to assist. And so we're a team of officers, social workers, the supervisor is a lieutenant. We also have a Acorn sergeant, and we also have a detective assigned to the unit. We are not 911 call driven. And let me back up and tell you how we came to be. So it actually was a thought process of our retired chief, Cassandra Deck Brown, when the city shut down due to COVID. We, of course, as police, were the only ones operating anywhere. So we, as police, also recognize that there are folks out there who were getting services were no longer getting anything and were out on the streets. And so with the help of our research and planning unit and actually a MSW, Master of Social Work intern, the unit was created. They actually got a lot of input, internal and external, before we were formed. And so there were work groups, both internally and externally. And there were lots of questions that they actually asked and took in order to create what we have so it fit Raleigh and Raleigh's needs. As an officer, I was one of those folks that gave input on the unit and then also thought, this might be something neat to join. And so when the application opened up, I then put in for it. So some of the things that we didn't consider or would not have considered had it not been like the external stakeholder input on what this should look like. It's even how we dress. And so our officers wear plain clothes. They do not wear the uniform. We respond as a team, but we are not 911 call driven. So most of our service is follow-up. And it may be immediate. It may be checking in with we have a lot of CIT officers out there in Raleigh that initially might respond to a crisis call. Once they have it handled, they've determined what they have, they may reach out to us, Acorns. And that means we either go out there immediately or we want to follow up within 24 or 48 hours. But again, it's substance use, mental health, and also homelessness that we're focusing in on. So our social workers are social workers. They are not clinicians, which means we don't assess and we don't diagnose. What we're doing is case management. So it's care navigation. And basically, we are making sure that we call them our contacts because they're not our patients, they're not clients. We use the terminology contacts. Our contacts basically are needing services that are out there in the community. So luckily, because we built those bonds ahead of time, Acorns has been able to have a seat at the table with the Wake Continuum of Care Network. And so we're a part of outreach teams. We're a part of the different service provider networks. We don't provide the service. Again, we just make sure that our contacts are getting connected or reconnected to services because that's what we see a lot of. And so what we're willing to do is walk with them through their journey of whatever they need for themselves. So we come up with care plans, but it's with them. We do have release of informations that we sign and everything so that we can talk back and forth to service providers about what the needs are for that individual. We also work closely with family members because there may be people who aren't ready yet, but family wants direction. They want support. They need the help in determining where they go from there. our detective is very unique. And actually the reason why she started with us because she helped develop the unit as well. She's very familiar with the population in Raleigh and helped to create it and make it what it is. But the way we've been able to utilize that detective division is to help us get a glimpse of exactly what we're dealing with and need to respond to. So before we even approach, we actually have an idea of who it is and maybe even what their triggers might be and that type of thing. She's also able to connect the criminal justice system in other ways. The court system, for instance, we can now vouch for our contacts or explain that they're receiving treatment. Acorns is voluntary, so it's not either you work with us or you go to jail. We will work with anybody who's arrested or not. Again, it depends on their journey and what they want. And that's kind of how we've been operating. So some strengths, because I've done my own little SWOT analysis about the unit, is that we are filling in the gaps for individuals. They need services and we're there to provide them. We're also humanizing the badge because again, people are saying, why is law enforcement helping? Why are police involved? Well, the fact of the matter is when folks call 911, an officer's going to be there. And I like to toot the horn of my officers that are assigned to my unit and say that they're not just shell of people and robots either. I have an officer that has a master's in clinical psychology. I have an officer that has a minor in social work. And I also have an officer who was trained in drug response because he started with a department in Toledo, Ohio, where they had a DART team there. And I have a master's degree in social work as well. So sometimes I don't think we give officers enough credit when we talk about them responding to calls, because some of us enjoy that type of work anyway, because we are providing a service and it's in Acorns, it's the S, the service part. So we want to make sure that we're doing that and networking with folks. So let's get back to some of the weaknesses that I've documented is we right now are working on having a database. We've actually looked into what Durham has and hopefully we can work towards having that. Operating outside of the scope sometimes. I have to bring my folks back in and say, we can't do everything. I only have 8 folks assigned to the unit and we're a citywide operation. So as you can imagine, we are spread very thin. We also don't have a budget. So again, we're not the service providers. We're trying to connect folks, but a lot of folks come to us when there's those gaps. So hopefully, we help to alleviate some barriers for folks, but we can't do all. The opportunities that we have left out there for us is to increase our overdose response. So we've been working with some of the community partners in Raleigh so that we can respond better to those situations and again, help connect folks after an overdose so they can get the treatment that they're wanting. The training and team building has been awesome, and we want to continue to improve on that and connect our actual police department with our Acorns team because we are housed separate and apart from the police department. We have our own building. We operate in our own little silo. We're like a little family, but there is the opportunity for us to reach out further. As far as the threats, sometimes there are special interest groups that focus only on one topic. And I've already told you guys that we focus on all 3. And so it's sometimes a matter of explaining to folks why we're doing what we're doing, because it's not the people that we're serving. They love us and the service providers. It's sometimes the folks outside looking in, deciding what they think we need to be doing, and they're not very familiar with what actually needs to occur. The negative press definitely isn't helpful, and we get some of that a lot of the times when we're actually doing great work out there. Again, we're a citywide operation and we're very small. So the hope is that, and I'll go ahead and tell you, yes, we are getting expanded. Thanks to RTI's evaluation of us, there was a recommendation that we get a database and expand. And so we have been approved for expansion for additional social workers, and there's a need for social supervisor. I am sworn, I have the social work background, but I do understand that there's some information that service providers can't and don't want to provide to me because I am a police officer. So I do think it is better to have an additional non-sworn supervisor who could also help to manage the unit. So.
What a treat. Good afternoon, everyone. Ryan, City of Durham. Thanks to RTI for hosting us, for all the support we've gotten over the last couple of years. And it's always a treat to be with my colleagues doing great work across the state. And every time I hear you all talk and hear how it's growing, I learn something too. The other thing that I note just listening is it is such an exciting time, an interesting time in the country. There's so much good work happening. There's so much variation. There's like lots of different things and different ways this work is being done. And it'll be interesting to see how it all develops over the next decade. So I'll tell you a little bit about Community Safety Department, what we do, how we got there, and what we're learning. So we were created about a year and a half ago, really as a result of a lot of the work that RTI did and their findings and their research on the 911 calls and what they presented to City Council that also included a landscape of like some of the interesting things happening across the country. And that led our manager to make a decision to create a brand new public safety department. And like when you think about the variation, one of the interesting things is where does the work sit and live? And you see all kinds of examples across the country, from continuing to sit in police departments to moving to fire departments to public health. And our manager, Wanda Page, made a decision to stand up a whole new public safety department. We sit as part of our public safety portfolio. And I think that's really important in the city of, it's really important for me, it's really important for our team, because it means that the police chief, the fire chief, our director of 911, and myself work together, that we have a common report and a deputy city manager who really is focused on collaboration, on good teamwork. And I think that type of structure is serving us well. I'll talk about the things that we do. We do 4 things right now. The first is called crisis call diversion. So we put licensed clinical social workers or other types of licensed clinicians into our 911 call center. So they are co-located, call takers, dispatchers, and our clinician all operate in one big room. And our clinicians do a few things. They're there to help triage and assess calls. So if a call comes in and it's a first person who may be experiencing crisis or maybe a family member with someone who's experiencing crisis, they can immediately connect that person with a clinician who is there, who can talk with that person, who can better understand their needs, who can make a determination. In some cases, sometimes people call and they want someone to talk to, and they don't need a response. Sometimes people call and they don't really need a first person. They don't need a first responder, but they're looking for resources and they don't know where to go. And our clinicians can help them make those connections. And then sometimes they're in crisis and they need a first response. And what our clinician can do in that moment is to remain on the phone with the person. We just had this happen the other day. I'm trying to remember what the call was, if it was a mental health crisis or suicide threat, but our clinician remained on the phone with the person in crisis, continued to de-escalate. Officers arrived on the scene and our clinician stayed on the phone with the person, and the officer said, continue talking to Jordan. She's, you can trust her. She continued to talk with them and helped this person who was very nervous about the interaction with law enforcement, just to encourage them to talk to them about how to engage in that. The officers ended up leaving the scene, and our clinician stayed with the person all the way while the mother took that person to the hospital, which is what that family wanted to do. And so I think there's a lot of benefits from having clinicians in a call center. Another thing that we're realizing about putting clinicians in the call center is it gives us the capacity to do follow-up calls. We don't, as a general practice in our 911 center, and I'm sure in many others, we don't have the capacity after someone has called 911 on a day to call back and check in on them. And our clinicians who are fully integrated in 911 read the CAD notes, the computer-aided dispatch. They look for crises where they think calling back and checking in on that person, maybe there were certain things that it looked like that person was looking for services. Even if they didn't get a chance to talk to that person, they will call back and check on people, make sure that how are they doing, or make them aware of other services, see if they would like help connecting to those services. And I think that follow-up has actually become the single largest thing that our clinicians are doing in the call center, and not something that we anticipated. The second thing that we do is community response teams. It's a little different than some of the examples you've heard before. So this is a new type of first responder, operates like other first responders in that it's fully integrated in 911. They're dispatched through 911. They have the radios, they have the computer terminals in their cars. But these are teams that are now responding to calls that 8 months ago went to law enforcement that now are going to non-law enforcement responders. It is a 3-person team. It involves a licensed clinical social worker, a peer support specialist, and an EMT. Peer support specialist, just to make sure that we're all operating under a shared understanding of that. When I say that, I mean that we hire individuals who have specific lived experience that might be relevant to those type of crises, which means we have people on our team who have been formerly unhoused in Durham. We have people who have who are in recovery. We have people who themselves or maybe a family member have experienced and lived with mental health related issues or illness, who are a part of that team, and their job is, because of that shared lived experience and that deep empathy that comes with it, to help build rapport more quickly. So it's a 3-person team. They respond to a range of calls from trespass to mental health crisis where the person is not being, where the person does not have a weapon and is not being physically violent, to suicide threat where there's no weapon, to intoxicated person, to welfare check, both urgent and non, a number of calls. They're able to transport people to the hospital, to other places that they want to go. That's that one. That one gets a lot of attention because there were, and we'll talk about it, there were concerns and questions about, can you do this? Can you do it in a way that's safe? The third is very similar to some of the things you've heard, co-response. Our co-response model is similar in many ways to Greensboro's model. We actually went out and, as part of the RTI work, visited with Greensboro a couple of times. So we have clinicians that are in our department that ride with officers in DPD, and we have created dedicated units. So we have a co-response unit that is a CIT trained officer paired with one of our clinicians. They're going to higher acuity behavioral health calls. So this would include where there's like a greater risk of potential of violence or a safety threat, right? And this means suicide threat where someone has a weapon. It means a mental health crisis where the person is reportedly physically violent. It means domestic violence, or it means disturbance calls and disturbance with weapons. So there are a range of calls. There's actually a wider range. We have a lot of calls we can get to with our unarmed response teams, and an even wider range that I think one of the things we talked about in the RTI work is, how do you know when there's a behavioral health crisis? The reality is it's very hard to know when someone calls 911. And so there are a lot of calls that have that potential need where having someone like a mental health professional as part of a team with law enforcement better positions us to try to meet the needs of someone in crisis. And I think we probably err on the side of making an assumption that a whole wide range of calls could involve a behavioral mental health crisis and pairing a clinician with an officer. Now, those calls may involve other officers, whatever the traditional, if the response plan was, we send 3 officers, we now send 2 patrol units and a co-response unit. So we're not taking away from what the law enforcement response would have been for those types of calls. The fourth thing that we do is care navigation. You've also heard great examples of that. For us, it's a clinician and a peer support specialist who follow up. The goal is within 48 hours after an initial crisis call or an encounter with one of our teams, where we have identified that someone needs and wants support connecting up to other community-based services. We'll meet with them within 48 hours. We'll stay with them. Our goal is to stay with them for up to 30 days to get them connected to other existing services. We don't describe it as case management, but as extended crisis management or something like that. I can't remember what we call it. So in a 2-person, we do a lot of things in teams. So those are the 4 things that we do. We got there. RTI laid a great data foundation for us. We continue to learn a lot from our data and from data from other cities. We talk about this being an emerging field, there not being a lot of evidence, but we did try to learn as much as we could from people doing like unarmed response work in Denver, San Francisco, Portland, Albuquerque. I find that cities are very sharing of their data and their policies. We tried to learn as much as we could. We took about 11 months before we launched our pilots. We did a lot of working. We formed a multi-agency planning team with police and fire and EMS and behavioral health providers and others that we met with weekly, not looking for, we all have to agree on this. It's not going to happen. But looking to make sure that we're all listening, that we're all hearing, and that we're working towards something that everyone understands how we got there. And that's worked well for us. I talked about learning from their cities, and then we had a bunch of different ways of engaging community, similar to other cities, from town halls to workshops and community that also shaped or the dress of our responders and other things. Our responders all wear a mint kind of green shirt with a big heart logo, a t-shirt, very approachable, but uniform in appearance. And yeah, so a bunch of things that came through that. A couple things that stand out to me. One, Integration in 911 is really important. In some cities that are doing unarmed response, you don't see that because it takes a lot of time. But for us, it adds a lot of benefits of being able to communicate with other responders, of a whole bunch of data things. But it's just, I think it's really integral, and sometimes it's a missing step. I always advocate for peer support specialists as an important part of a crisis response work. I think the clinicians and EMTs or paramedics are very common across the country, and there are fewer examples of including peer support specialists, and I think they bring real expertise to the work. And I'm sure other things will come up through the questions. You want to use this one?
Can you all hear me? Okay. This one's not turning back on. No, thank you all for the overview for your programs. That was a great overview. And, you know, I'll personally speak just for a minute. I may be a little partial because I did work on this project, but I had the opportunity to meet with all of them this week to kind of dive deeper into their programs, meet with their staff, meet with some of the providers, and then even the communities they serve. And it was awesome to learn more about the programs, dive a little deeper, I said, but to, I'll be honest, everybody we talked to, not just staff, but providers in the community had such positive things to say about all of their programs. I know Lieutenant Lockhart mentioned the negative press being one of those downfalls, but there is a lot of positive press too that comes out, and we see for those that aren't local here to North Carolina, there's a lot of positive stories that come out of these programs. So we're excited to see kind of how they grow and develop. And I talk about what champions you all have been, not just for our project, but for alternative response models for your cities and for the state, really. So it's awesome to see how these have grown. And so we want to go, we're going to pass it back or transition back to Dr. Kramer for just a moment. He's going to provide just an overview of some of the key findings and takeaways from the Cohort of Cities project.
Thanks, Elise. And thanks everybody that really enjoyed the presentations. Yeah, just wanted to touch on a few key takeaways after listening to you all and after conducting this Cohort of Cities project. One thing I'll also mention is the final report for the project is publicly available, so we can share that with folks, because through that report we really go into a lot of detail on the different programs, some of the different findings and key takeaways. But some of the takeaways that stand out to me, at least you just gave me a good segue. Identifying project champions is really was our number one sort of takeaway. There's going to be a lot of issues, a lot of roadblocks, a lot of working things out. There's, you know, in a city setting, there's many departments, and sometimes what comes with that, even inadvertently, there tends to be silos or particular areas where different departments have certain turf. And when we're thinking about alternative responses and reimagining or rethinking how we approach some of these challenges, it also involves then rethinking some of those silos and some of those areas where work has traditionally been done. So having a project champion was really very important. And the three of you sitting up here presenting on this, I mean, you are champions for your work in your respective cities. It's really important because otherwise it's a challenge to get some of these programs up off the ground. There's many challenges anyhow. So really having you all to lead the work and to share it is really, I think, of the utmost importance. Something also that Ryan mentioned, you know, learning from other cities. You're all here sharing because it's so important to learn from other cities. No one has a monopoly on how to do all of these things, and even where they have been done, trying to translate those to your city, to your unique situations, and with your various stakeholders. These are really sort of iterative learning opportunities. So having somebody who's willing to go out there and champion for this work internally, but also externally, is really quite important. A different takeaway was the co-development of goals. And what I mean by that is there's a lot of stakeholders involved, not the least of which is the community. So understanding what community goals are, what police goals are, but also other city departments, whether health and human services or the fire department and EMS or the public safety answering points. There's a lot of stakeholders involved. So having one agency lead this work is often a necessary condition for getting up and off the ground, but the co-development of goals and thinking through those with the broader audience is very important. One example on that front, a common goal may be something like the reduction of the use of force. But in practice, use of force is typically around 0.1% of what police events. So there's a whole lot of things that police are doing. And if you're only focused on use of force reduction, you're really missing the largest parts of the picture. So rethinking ultimately where you want to have an impact or how you want to have an impact is important as you consider what programs are most important or most effective for your city. Implementing and evaluating these. So again, these are learning opportunities, and there isn't a strong evidence base for a lot of them. We're developing that evidence base right now. So as a city, you will not get it right your very first iteration, or maybe your second or your third. There's going to be revisions and review. So collecting the data in a way that allows you to revisit that, to think through what the impact is that you're having and what impact you want to be having. And being willing to reconsider and reevaluate policies as you go is going to be an important step. Last but not least is the sustainability of these programs and how you sort of bring them to scale and how you support them. A common challenge, I think, across all cities was staffing, and how you get sufficient staff and the appropriately trained staff into these roles. So that involves things as basic as rewriting of job descriptions and those hiring processes, and those can take a long time. So having a longer term plan on how you will get that recruiting pipeline, how you'll dedicate the necessary resources should really be at the forefront as you're developing these programs and you're thinking longer term. So those are just a few of the takeaways. I saw in the chat, there was a link to the final report, so you can see the rest of those if you're interested. But I can't see how many people are in the audience. But I think turning it over to Q&A and hearing from the panelists would be a great place to go. Thanks.
Yeah, thanks, Jake. And so before we move kind of into audience questions, I know we were going to kick it off with just two questions for our panelists, and anyone can start or answer first. One of the items we were interested in, and I know some of you spoke about this when you were giving your overview of how did you build buy-in for your alternative response models, and if you could include, how you did that with the police department in particular, the officers, the communities that you serve, and then other city department and management. I'll pass it down and let you all fight over it.
Okay, well, I'll go. I got it in my hand. So I think one of the things that we did in terms of building buy-in is we surveyed the officers. RTI came in and we had some focus groups with groups of officers, and we talked to them about, what works, what are the things that they were comfortable in terms of the calls, like what types of calls. I think one of the questions, I believe it said something like, what is the call that you are kind of the most uncomfortable, or the one that you don't like the most? And overwhelmingly it was like the mental health calls for service. And, to get feedback from the officers in their own words that we could take to council. And I mean, their words were, we want to have individuals to assist us with this. This isn't what we signed up to do, and we want to help people, but we don't have the capacity to be able to do it by ourselves. And so, having the officers on board, because I think like Lieutenant Lockhart said, officers sign up to help, contrary to, I'm not even gonna say popular belief, because that is not popular belief. I feel like if you know enough police officers, police officers sign up because they want to help people. Just like when you ask kids, what do you want to be when you grow up? They say a police officer. Why? Because I want to help people. That doesn't change as officers grow up and come into departments. So they have that desire there to want to protect, serve, and help individuals. But you know, when you're tasking them with having to do everything, sometimes that gets complicated. So hearing officers' voice, having a third party that was not us beating on the door saying, we need this, having that data to support, hey, this is something that, you know, our city needs to look at. That was really helpful for us. So.
Does this work? Okay, good. So I think there's things you can do before you start it, but for me, I want to focus on what things you do after you launch, because I think that's where we've made up the most ground. I think in advance of doing something and you're talking about it, you can share your plans and create spaces where you're talking together to help build confidence. There's still going to be a lot of understandable skepticism and questions. Some things that we've done that have, I think, been helpful. One, all of our responders operate on the same police channel as all of the police officers in Durham. And that has had some unintended benefits. That means our officers get to hear us working. And that's good, because one thing that officers will say to me is, I've heard your team on the radio. You sound like professionals. You're taking calls that I'm not having to come to, and I appreciate that because my plate's full. And so I think, you know, that sense of being able to demonstrate the work and create ways where there's transparency around that for officers to be able to hear our teams on the radios has helped. I think transparency in data, the biggest question we had was safety, especially for our unarmed response. We created a data dashboard. We tell you every day, basically that data updates every day, how many calls have our responders felt safe on? 99 point something percent. How many calls have there been an assault on one of our responders? How many times have our team radioed for emergent police backup? We're just very transparent about all that. And that, because I think it's just about being transparent and building confidence that this can be done and be done well. Another thing I'll say is leadership matters. I'm talking about my leadership. The leadership in the police department matters. We have a fantastic, fabulous, exclamation point police chief, Chief Andrews. We also have great support from the sheriff's office and Sheriff Burkhead. For leaders in public safety to see the value in this, to not feel threatened by it, to understand that this can be collaborative and complementary really goes a long way. It takes a long time to, I think, build that support. If you were asking me where we're at, I'd just say we're going in the right direction. That if you were to poll everyone in Durham law enforcement, you would find a wide range of views about our work. But I genuinely think that it's going in the right direction because of transparency, because of mutual appreciation. Our team sends kudos emails to senior leadership in each of our law enforcement agencies when we see law enforcement doing great work in the community. And part of that is to show, despite narratives in the community that may frame this in antagonistic ways, or it's either this or that both are needed, and for our team to be able to recognize and lift up and applaud great works of compassionate care among law enforcement is another thing that I help is building a stronger collaborative relationship between.
Thank you both. One of the things we also did was make sure that we went to the roll calls and explained to patrol officers what we were doing and why we were doing it, but also being open to the feedback from them and what they needed from us as well. So RTI also surveyed our officers and they were honest in their feedback of Acorns. And so one of the things we want to try to do more of is show them that we can help them, because we do want to reduce call for service, and we see that happening, but we want them to see something tangible too. And so we've been open to actually, now we do some discharging IVC calls. We'll take those, and we are going towards being dispatched to some calls for service. I don't want us to increase it to a lot, but be dispatched to some calls is what we're working towards in the future. But then also it left me the last thing that I was thinking about as far as our office. Oh, command staff, making sure that they're aware of what we're doing. And actually, a lot of times what ends up happening now is they're sure to bring us in on their plans, whether it be for, violent crime or, projects that they're running. They're always going to bring in acorns ahead of time and during. So, and that's something new to law enforcement, like realizing that you can utilize this unit to help the community as a whole. So yes, you might have to do some enforcement action, but what if prior to that enforcement action, you're assisting people so it doesn't lead to that? And then even after the enforcement, how can we assist them with getting treatment and things like that? And so our command staff reaches out to us on a regular basis to assist them in their projects that they're conducting. So.
Thank you so much. Another question we had, and this one's specifically for Ryan and Letitia. Both of you set up, Ryan, you all established your Department of Community Safety. Letitia, you set up your Office of Community Safety. Can you talk about how your relationships in setting up those departments, how your relationship specifically with the police department has evolved?
I mean, I feel like I touched on this a little bit. I would say that we have a very strong collaborative relationship with DPD, and that is especially strong at the top and is getting stronger when we talk about like frontline patrol officers. I think that it has been, we try to frame as a new public safety department, how you talk about the work matters, especially if you want to build strong relationships with the other public safety agencies. So we've tried to be humble, be appreciative of others, be data-driven. We try to always frame our work in ways that don't come across as like going after or being critical of other important first responders, of recognizing the crucial role they play, but of being clear about the value that we add and the calls that we can respond to. So we talk a lot about sending the right response. And sending a response that can allow us to better address or do an even better job of addressing the needs of residents in crisis. So I think the way that we talk about this work within our departments, outside in the public, really matters if we're trying to build strong relationships across public safety agencies. And then I think, we did the whole roll call thing. I got lots of officers were very transparent about how they felt and their questions. And a lot of them also said, and I hear this a lot, we hate change. And there's a good self-awareness. I mean, that directly, we hate change, and it takes time and being able to just do the work, show your work, be humble, and I don't know, it takes care of a lot. And have an amazing police chief. Go Patrice Sanders.
Okay, so for us, from the beginning, our police department has been on board. Chief John Thompson, at the time, Deputy Chief, has been one of my strongest supporters from the onset of this, as we were going through this cohort of cities. And we were talking about, okay, well, how do we implement these things? How do we get these things to work in our community? And he's like, we need an Office of Community Safety. And every time he was given opportunity to say that, he said it. And he's been unapologetic about it in his support. And, it's top down, because what has happened is he's talked about the need for it so much to where now others see the value and the need, so much so to the point where we actually, when we announced, I had someone come up to me and say, oh, I thought we were doing that already. I was talking to the chief, and I thought that was already something that was out there, because he's, as a department, they have been speaking about having that support to assist them in implementing these alternative responses, and actually looking at the community as a whole and bringing in community-driven solutions, recognizing that they can't solve all of the problems of the community, and that is going to take all of us as a community. Oftentimes we'll say police versus the community, or it's either the police or the community. And I think I was eating lunch, I was saying I didn't grow up in police town. Both my parents are law enforcement, so I didn't live in a special police bubble. We didn't go to police school. Like I was in the community with everybody else, and so are these officers every day. They live, work, play in the same places as everyone else, so they are the community. So understanding that we're one, and we need to work together collaboratively to get the job done was important. And expressing that to our leadership, having a city manager who was able to see the value in, creating this office and supporting this office so that it can be sustained. Because it's one thing for people to do, there's a lot going on in our country right now. People are, alternative responses like a hot button word, it's like, ooh, alternative responses. It's like, okay, great. But how do we stand these up and make them sustainable so that 5-10 years from now, me and Ryan both have our offices, and it's not like, oh, okay, well, yeah, we funded that for a little while, but now we moved on to the next big thing. So just making sure that those things were implemented, and having RTI really to support the initiatives that we were trying to put in place. I think someone had asked the question about, what has the cohort of cities, I don't know if you're gonna get to that question, but what did the cohort of cities do for the city of Greensboro? I mean, if I'm being honest, is part of the reason why I'm sitting here right now, is what it did for us, because it showed the value of having, an office to support these alternative responses and community voice, and having that space where we can all work collaboratively together. And it gave us the data to support our recommendations, because it's one thing to just, beat on the wall and say, we need, we need, we need. It's a whole other thing to be able to have, look at this nice, pretty document. You all make great documents, by the way, just FYI. Look at this document right here. And, oh, look what it says. It says we need this. And sometimes city council, they need to hear from someone other than the person who works, for the city. They need to hear that the thing is valuable, and then they need to hear that other cities are doing it too. So that was another value of the cohort of cities, is we could say, well, Raleigh is, Durham is, and it's like, oh, they are? Okay, well then in that case, so just leaning on each other to do that.
I know. No, thank you for that. And that wasn't a question, but we're happy to hear it. It's exciting to hear. We were happy to support you all, and thank you for sharing your experience. I'm going to pass this mic back to Lieutenant Lockhart, because on the other side, if you would talk about the relationship between your non-sworn staff, your social workers, how that's evolved with the officers as well, because I think you mentioned there maybe were some initial challenges there.
Yes, and when I say that, it's primarily patrol officers, not necessarily the Acorns officers. And so now they recognize exactly the value that the social workers bring to the work, and they actually lean on them to assist in cases where they know it's beyond what they can do. And so, and just to speak from a community perspective too, I think what's also been helpful is seeing officers reaching out. The service providers were surprised that, wow, y'all are police, or y'all work for the police department and y'all are doing this. And so that has, even brought the service providers more so on board. Now our chief, I have to shout out my chief too. Estella Patterson is a rock star when it comes to the community. So she's always everywhere. And luckily enough, I'm sure she's hearing about how Acorns is also everywhere in the community and connecting. And so there's that positivity on all sides about how we're doing this work in the police department with social workers and officers. So.
Yeah, thank you. You all hear me okay? Okay. We want to take a moment. I know that the audience may have some questions, or we may have some questions in the chat.
Yes, there is one online. So which models would be transferable to rural communities in your state, since Durham, Greensboro, and Raleigh are more urban, larger jurisdictions?
And I want to say, I don't want to put our panelists on the spot. I was going to say Dr. Kramer may be able to speak to that space, so we don't want to forget about him virtually.
No, it's okay. Maybe I can get started, but then I do actually want to turn it over to the panelists. I'd be curious their perspective. So yeah, the question is essentially what alternative response programs might be transferable to more rural communities, given some of the examples here are coming from larger, relatively wealthier communities. A few things stand out to me. One of the programs that we worked with in Burlington was a teleserve unit. So telephonic response to calls for service instead of having an officer respond to someone's door. That could also be coupled or paired with online reporting practices. So for non-emergent sometimes larcenies, calls for information, things that traditionally officers would still respond to and still take up time. But there are sometimes more efficient or convenient ways for community members to report issues or request information that would be transferable. Something as I say as simple as, but it's hugely important, classification of mental health calls through the Emergency Communication Center. It's really difficult to understand the scope of the problem or the scope of different issues in the community if you're not intentional about how you collect data on those issues. And one thing that we saw in many of these cities is how mental health calls are being classified within the Emergency Communication Center. It varies, and there's often different approaches to how that's done. So a standardized, a well-trained sort of approach to how do we intentionally collect information on these issues that we say are important, but if we want to look back over the past year, I can't tell you how many calls have involved mental health crises. That's a problem. So even something as simple as developing intentional standards for classification of data is really important to understanding the scope of the problems. A different one that we didn't talk about today, but we explored with some of the cities is alarm verification. So officers will spend a lot of time responding to alarm calls, but more than 99% of the time, those are false alarms. So there's also some opportunities within cities to push some of that alarm verification back onto the alarm companies, which then saves officer time and resources. But I'd be curious to hear from the panelists if some of the programs that you've talked about, if there are different aspects of it that you would identify or think of as transferable or something that could be implemented in smaller jurisdictions.
Yeah, one thing I would recommend is connecting with your Department of Health and Human Services. And, you don't necessarily have to have a social worker that's in your police department, but partner with them and come up with an MOU so that there is some care navigation or some connection when it comes to response to 911 calls. I remember back in the day, back in Raleigh, we had an MOU with Child Protective Services. So after a situation, they would come and ride along with an officer to go and do a follow-up call. And that might be a way to be able to bring that to a more rural area, is utilize the resources that you already have and create a MOU or partnership to be able to get the work done in the meantime.
I think it's a great idea. I mean, I think in general, I don't think there's a single thing that we've talked about that in some way couldn't show up in a rural county. I think we're talking about widening our imagination of the kinds of professionals and training that we also want to be involved in first response, and whether that's through partnership with social services or public health, or the ability to bring on one additional type of professional into law enforcement. I mean, or thinking about how you diversify the 911 call center for a county or for a region of counties. Those things could all still apply. I just think that that's an underlying theme around all this work. And then there are different strategies to do it. And also thinking about telemedicine and other things that are learning lessons from maybe how healthcare, we're thinking about addressing healthcare issues and applying it also in public safety. So I don't see anything here that is off the table.
Yeah, thank you. Do we have any additional questions? We do. We have a few.
Hello. Oh, first of all, I'm a Durham native and I work at RTI. So this collaboration is, I feel it in my heart. And I love this. And so there's a lot going on in Durham. There's the gun violence crisis, growing population, and a lot of concerns that the police department can't keep up with response times, and there's slow response times. Do you think, or is there any data or on how this is impacting their response times to other crimes?
I mean, it's a really good question. I don't know that we have been operating long enough to draw a comparison. RTI will probably work on that over the next few years. So they're doing a multi-year analysis. And I think your question of, as we have these new types of responders available and relieving some of the calls to go to law enforcement, how do we see that playing out in other calls to which we're not responding? I think it's one of our theories of the benefits of this is, and we do quantify. If you go to our dashboard, go to City of Durham, Community Safety, you'll see our public facing dashboard. but I don't think we have it up, but we will have it up how many hours that we save in response time that law enforcement is then freeing them up to be available for other calls. And I think thinking about how that shows up, do we see benefits down the road in increasing response time? And can we draw that in like a causal way to this or not? Those are good questions for our evaluators. But it's a great question. And certainly we absolutely are in a quantifiable way freeing up over 1,000+ hours right now for law enforcement from these diversionary things that are taking calls that we're going to law enforcement. And there should be, I would hope, some benefits for our partner public safety agencies.
Can I jump in? I know you said Durham, but so one of the things that has happened as a result of this is under the Office of Community Safety in Greensboro, we have a violence prevention coordinator. So we have someone who was hired within the city, and the responsibility for that individual is to help to create our comprehensive violence prevention strategy for the city. And so what we as an office are, what we're doing is we are bringing in multiple departments and we're focusing on violence, what violence prevention and reduction looks like in our city. We have violence interrupters. We have people who are doing that work already. We have some folks who are focused on violence prevention. And as a department, we are trying to build ways to work with the police department to address violent crime. So I think what happens is I can't answer the question in terms of like quantifiable hours and things of that nature, but what I can say is that the question about violent crime and gun violence specifically and gun violence reduction is a community responsibility as well. And so I think having opportunity to provide community voice in that is something that I'll just say stay tuned, because I think that it's going to be highly effective in our city. So.
Any other questions? Oh, great.
I'm not quite used to a mic, so sorry if I scream. I'm gonna ask about the dirty question of data. So I'm with CMPD, and we have an embedded co-responder team, and then we have one that's in the pilot program. We don't know quite where that's gonna land when the pilot's over. So I think you said maybe with Raleigh, the database, getting the data into a usable format. What is that looking like, or what has been the barrier so far? Because right now we have a lot of barriers for the pilot program that's not landed with a permanent home yet.
We're still working on that. But part of my role has been trying to get that up and running. And that means looking at what Durham is doing, because I think they started at the same time that they got up and running, they started with their system. So we're behind the curve on that part of things. And so we're just trying to work towards it, because the Excel spreadsheets and relying on staff to do what they should be doing is definitely a barrier for the supervisor that also wants to show the great work that's being done. So, but everybody recognizes the need for it, and thanks to RTI for the feedback, because now we're there. I just gotta actually find the actual great fit for us. So sorry.
And you said you were with Charlotte Mecklenburg. It's not too late to join the cohort. If you want to get involved, there's a lot of good information and learnings and sharing. So we should follow up after and talk about that.
Evaluator.
Not RTI.
So we have a grant from the state that we use part of like 300,000 for an external evaluator, and it's the evaluation group out of Atlanta. Yeah, so they're doing great work, but they were brought in on the back end. And so the whole setup and getting the operations logistics happened at lightning speed, it felt like, and then getting the evaluator brought in already behind the curve. And so the data portion, with the homeless management information systems, getting, agreements, what is the issue? We have issues with people wanting to share databases where we can have access to it, because as first responders, the public records request. And so the different things like that are just barriers. And there wasn't enough time to work it out before we launched.
I feel really weird having conversation on
Right,
the
right there.
microphone when we're 6 feet apart.
I still feel like I'm shouting.
No, but there's a few different systems. I'm not going to name them by name, but I know Durham has one. Raleigh is looking at one. I think Greensboro is considering as well. So there are options. We can talk about that offline after.
Sure.
And I would love to talk with your evaluator about the work that you're doing down there
Sure.
in Charlotte. Quick question. First of all, Brian Agard, I'm a big fan of all the work that you're all doing. So one of the questions I had, Director Smith, you talked about this, you touched about this on the safety of the responders. So I think that there's obviously been, and rightly so, a focus on the acute safety during the call. But what about some of the compounding effects of stress and trauma and the secondary trauma that these folks are seeing and experiencing? Has there been any thought to the well-being and resilience of your responders? I know it's been a hot topic in law enforcement. I see that it would be something of interest to you all as well.
Great question. Other colleagues probably have good things to say about that too. It's something that we talk a lot about, Brian. And first, we're big fans of you too. It's something that we're caring a lot about and thinking a lot about, and we have aspirations for having a really great wellness program and helping also support our other first responder agencies in thinking about that space and what it could look like. But we have quite candidly been so busy in the first 6 months just standing up and trying to do the work that it needs more attention and care from us. So it's probably under construction. So stay tuned. Maybe next year we can come back and talk about responder wellness.
And I know for us, that's something that it has been very big in our office, and we've had discussion regarding that. Our team lead and myself have talked about how we can offer support to the clinicians that are doing the work, aside from the already available resources that many cities may have for wellness care. But even as to kind of go off of the previous question or comment regarding our violence intervention, violence interrupters, one of the things that we were talking about is we build capacity for those folks in our office is making sure that their wellness is supported through allowing space for our clinicians to be able to work with those individuals as well. So that's the way that we're looking at it, is we want to try to do a holistic approach to all of that, because all of the things that we're doing involving working within the community and seeing all of these things, just like law enforcement on a daily basis, you see so many instances, and it's on to the next call, but we're trying to be intentional about how we allow our therapists right now, and as we go forward, our violence interrupters as well, but allowing them space to stop. Hey, you need a moment, take a moment, stop, gather yourself. You don't have to jump right back into it. And just making sure that folks feel supported when they do that, because a lot of times you think, I gotta do it all. I can't stop. I can't let anybody see me. So we are trying to create an environment where it's okay to take a breath, because we need you whole. We need you healthy. We need you ready to go. I want you to use your vacation time. All of those things are important. But those are things that oftentimes people don't hear.
So for Raleigh, one of the things that we did, because we knew that they were going to be Raleigh Police Department employees, we were very intentional with, I already told you, we have our own space where it looks different, it's set up different than the police department side of things. And then that as the supervisor, we already have scheduled built-in time where we meet as a team and we can debrief and we can talk about whatever everybody wants to talk about. And that allows for the team building exercises and that type of thing. I also do, with my social work background, 101s, and the social workers love it, right? My officers are like, oh, here we go. But my social workers love it and they want it and they need that. And so we're making sure they're supported in that way internally, but then also the Raleigh Police Department, because they're employees, they have access to the same things that our officers do. So our peer support program, we actually have non-sworn professional staff who are part of peer support. So they aren't officers, but if somebody wants to reach out to them, they can. We also have Families Behind the Badge, which is a resource for not only our law enforcement family, but also our non-professional staff to come and enjoy and talk and debrief and look at wellness and everything as a component as well. So we kind of made sure that we wrapped that around and things as we were creating the unit.
Thank you. I want to make sure we don't have any additional questions from our in-person or even our virtual. Okay, well, great. I want to thank our panelists again. Again, thank you for just responding to the call and for the work that you're doing in this space. We want to take a moment to recognize Arnold Ventures, who helped, who funded and supported this work with the Cohort of Cities project. So again, thank you all. Thank you, Jake. I know you're virtual. Thank you as well. So I'll transfer it back to Peyton and Dr. Strong for closing remarks.